My name is Melissa,
And I'm Laura.
and we're going to be demonstrating the first portion of a clinical swallow evaluation, which consists of a patient interview as well as an oral mech examination. All right, so before we start, I'm just going to ask you a few questions. So why are you here today, Laura?
I was referred by my doctor, so just
Okay.
following up.
Okay, are you noticing any difficulty with your swallow?
No, not particularly.
Okay, all right, so I'm just gonna ask you some questions about your diet. So what types of foods do you like to eat?
A lot of cereal, a lot of eggs, a lot of coffee, lots of coffee.
Okay, so any of the foods that you've described, are there any textures that might give you some issues with swallowing?
No.
Okay, how frequently do you eat?
3 or 4 times a day, usually.
All right, and any changes in your diet?
A lot more cereal these days, yeah.
Okay, all right, have you had any unexplained weight loss?
Weight gain.
Weight gain?
Yeah.
Okay, all right. So I looked in your medical history and I noted that you did not list any medications that are at least prescribed. But let's say you get a headache, you need to pop an aspirin. When you swallow that pill, how does that go?
Yeah, it's totally fine, yep.
Okay.
I don't feel any sticking or anything.
Okay. Do you have any history of TMJD?
I do actually, yeah. I dislocated my jaw a couple years ago.
Okay. Do you ever notice anything like dry mouth?
If I drink a ton of coffee but no water, sure, but generally no.
Okay, that's pretty common. All right. And last thing, do you have any family history of any type of swallowing disorder or swallowing issues?
Yeah, I have an uncle who had esophageal cancer.
Okay. All right. So I also noticed in your medical history you don't have any history of neurologic disorders, no prior surgeries, and it says here that you don't smoke.
Nope.
You ever been a smoker?
Nope.
Okay. All right. And I also noticed that you have GERD. So how does that come about? What types of foods bring that on?
Typically onions, and it is silent reflux, so I don't necessarily feel it.
Okay. All right. So just by completing this interview, I can see that Laura's cognitive status is good. She's alert, she's oriented, and we can go ahead and proceed with the oral mechanism examination. All right. So Laura, today I'm going to do an oral mech examination. I'm also going to see how your cranial nerves are functioning. So I'm going to ask you to do a bunch of different things with your jaw, your lips, your tongue, and your teeth, and I'm basically just making sure everything is functioning the way that it's supposed to. All right. So to begin, I want you to go ahead and just look straight ahead at me. I'm going to observe your face at rest. What I'm looking for is any asymmetry, so if there's any drooping on one side of the face, any weakness. I'm also looking for abnormal movements while you're at rest. Your face is symmetrical. I'm not noticing any weakness on either side, and there are no abnormal movements. So everything looks normal on that front. All right, so now I'm going to go ahead and assess your lips. I'm going to be looking at quite a few things: range of motion, strength, and I'm also going to be assessing your facial cranial nerve to see how that's going. All right, so Laura, I want you to purse your lips and then release. Watch me first. Okay, perfect. All right, so now I want you to smile and then release, just like this. Okay, good. All right, so now I'm going to complete a 6-point examination to take a look at your lip strength. So with my tongue depressor, I'm going to press on 6 different points on your lips. I'm going to apply a little bit of resistance, and I want you to keep your lips closed. Okay, ready? Okay, all right, so Laura has good lip strength. She kept her lips closed when resistance was applied. All right, so now we're gonna take a look at the muscles of mastication. I'll be looking at your mandible, otherwise known as the jaw. So the first thing I want you to do is just open your mouth, just very casually, just like this. Okay, so now I'm observing your jaw at rest. I'm looking for any type of asymmetry, any deviation to one side or the other. Not noticing anything there. Everything looks normal. All right, so now I'm going to go ahead and assess your oral cavity and your dentition. So I'm going to be looking at your mouth and your teeth. All right, so I'm going to go ahead and use my tongue depressor, and I'm going to use my flashlight to look in your mouth. So if you could go ahead and open wide. All right, so I'm going to go ahead and observe. So first I'm going to check out your buccal cavity or your cheeks. Okay, so I'm not noticing any scarring I'm not noticing any pocketing either. Everything looks pink and healthy. When I look at your teeth, I don't notice that anything is missing. They're white. You have good hygiene. So once again, there's no lesions on the gums, and I'm not noticing any evidence or signs of thrush. Looks pretty good. Okay. So now what we're going to do is assess the strength of your cheeks. So basically, I want you to fill your cheeks with air so you look like a chipmunk, like this. Okay, good. So and you can look up. So what I'm going to do is have you fill your cheeks with air. I'm going to apply some pressure to your cheeks, and I don't want you to let the air come out. Okay, are you ready?
Mm-hmm.
All right, go ahead. Okay, good. So her cheek strength is pretty good. She did not release any of the air with some applied pressure. All right, so now we're going to be taking a look at the integrity of your tongue. So we're going to be looking at how strong it is, the range of motion, and so on and so forth. So to start, I'm going to have you go ahead and just open your mouth so I can take a look at your tongue at rest. Okay, a little wider, please. There we go. All right, great. So I'm looking for any signs of atrophy or weakness. I'm also looking for something called fasciculation. Basically looks like there are worms moving underneath your tongue. This is from lower motor neuron involvement. So I'm not seeing anything abnormal, no atrophy. It's a nice pink color, no fasciculation. Okay, so your saliva also looks normal, nothing too thick. So I'm also looking for any structural changes, but your tongue looks normal. So everything looks good there. All right. So basically what I want you to do to start, I want you to take the tip of your tongue and put it behind your teeth like this. Good, okay, so now take the tip of your tongue and put it behind your teeth, your bottom teeth like this. Okay, good. So now I'm going to put the tongue depressor in your mouth, and I'm going to apply a little bit of resistance, and I want you to raise the tongue depressor to the roof of your mouth. Okay? Perfect. Okay, so keep your tongue raised. I'm going to put the tongue depressor at the bottom of your tongue, and I want you to push the tongue depressor down. Okay, perfect. Very good. All right, so go ahead and open your mouth again. I'm going to apply some pressure to the side of your tongue. I basically want you to push against me. Don't let me push your tongue to the side. All right, here we go. Okay, very good. Let's try the other side. Okay, very good. All right, so Laura has demonstrated normal tongue strength. She was able to fight against the resistance. So now I'm going to ask you to move your tongue to either side of your mouth like this. Okay, very good. So good range of motion. All right. So now I'm going to take a look at your velum, which is your soft palate, or basically the back of your mouth. So I'm just going to observe your velum at rest. So go ahead and open wide. Okay. All right. Okay, so I'm not noticing any asymmetry. Your velum is symmetrical. So now I want you to say, ah. Ah. Great, so I noticed the velum elevated when she said ah. Noticed no asymmetry there. So now I want you to say ah, 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 ah. Okay, once again, we have perfect symmetry and elevation of the velum, so everything's working the way that it should be. All right. So now, Laura, I'm going to test your gag reflex. This might be a little bit uncomfortable. I'm going to ask you to open your mouth, and I'm going to gently walk the tongue depressor back until maybe we hit a gag reflex. Okay, are you ready? So go ahead and open your mouth. Okay. Okay, all right, so there is no gag reflex that I noted, which is totally normal. Not everybody has a gag reflex. Okay, as far as voice quality goes, when I had you say ah, I didn't notice any hoarseness, I didn't notice any breathiness, and I didn't notice any type of wet or gurgling sound. I was also looking at that while we had our interview, and your voice quality sounds normal. So another thing that I'd like to do is test your dry swallow. So a dry swallow is when you swallow and there's no food, no liquid. Okay, I'm going to be looking to see if your laryngeal mechanism or your throat lifts when you swallow. Okay, all right, so I'm going to go ahead and place one finger here underneath the belly of your tongue, one finger here, and another here. Okay, so I want you to go ahead and swallow. Okay, good. So I felt some elevation of the larynx, so your swallow feels normal in that sense. All right, and then the last thing that I want you to do is go ahead and cough like this. Okay, so you're able to cough. All right, so Laura, I think that concludes our oral mechanism examination. We have one more thing that we're going to do. All right, so Laura, I want you to say pa.
Pa.
Okay, can you say that 5 times?
Pa, 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 pa.
Okay, good. And how about ta?
Ta.
And go ahead and say that 5 times.
Ta, 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 ta.
Okay, and the last sound is ka.
Ka.
Say that 5 times.
Ka, 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 ka.
Okay, so now I'm going to have you combine all of those sounds, pa, ta, ka. And I want you to say it as fast as you can.
Paraka.
Okay, go ahead and say that 5 times.
Paraka, 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 paraka.
Beautiful. All right, great. So I think that actually concludes our oral mechanism exam. From everything that we did, you seem to have normal strength, range of motion, for everything that you need to swallow. All right, so that's it. So Laura, I'm gonna have you move on to the next portion of your clinical swallowing evaluation, which is going to be PO trials.
Okay.
Okay, thanks
Thank
for
you.
coming in.